Yes.
And can you see that okay?
Mm-hmm.
Perfect. Go ahead.
So this is actually a client that I presented before, and unfortunately, the situation has not really gotten any better. I have tried to reach out to her teacher because things are going really great at school, but still really, really bad at home. I've not heard back from the teacher. The biggest thing here lately is that when I try to ask her what the deal is between her and her mom, all she really tells me is that she hates her mom and she wants her to be unhappy. But at the same time, she freaks out if her mom is not within her eyesight all the time. Mom never gets any personal time, any personal space from her. She won't do anything at all to help her mom. She won't even really do her own self-care without mom supervising her. Every time she has a bowel movement, she screams for her mom to come wipe her butt. And mom's done. She doesn't know what else to do. Her therapist doesn't know what to do. The child's therapist doesn't know what to do. I've made a RAP referral. I'm waiting to hear back from them. I had some issues getting it sent in. And honestly, I'm not sure what to do to help them. We tried picking out rewards that mom was able to do within her financial limitations. We let her pick the things she wanted to work towards, and still nothing. And I don't know. They tried to get IDD waiver. They've got denied for it. Mom is appealing. I'm not sure if mom's tried to do CSED. I told her to try both. It couldn't hurt anything. But mom is at a point now that she's really ready to just put her in residential treatment because her own mental health is getting so bad dealing with this. And it's just with mom. If she is with her grandma, she's fine. If she is with another adult caregiver for a little bit of time, she's fine. She's fine at school. It's just with mom. So anything anybody has to give me any ideas of what to do to help this family, I am all ears.
Cheryl, I know you talked last time, so I apologize, I can't quite remember this. So the diagnoses are autism, ADHD, ODD, anxiety, and depression.
Yes.
But the IEP is only for anxiety.
Yes, because the school says she doesn't have autism. I don't know how that works, but that's what they said.
Okay. And she's been denied for waiver. Do we know her functioning level? Can you tell us about what she looks like functioning wise, or do we have an IQ testing on her?
I think her IQ is probably what disqualified her from being able to get IDD waiver, because I think she scored IQ wise in the average range, and she didn't meet the number criteria to automatically be able to get IDD waiver. She is capable of doing the things, she just won't do them for her mom.
Okay. And then, do we know where the autism diagnosis, did she have a full evaluation?
Yes.
Okay, for the autism diagnosis. Do we know anything more about that as far as like functioning? Where's the autism diagnosis coming from? What are some operations?
It came from the original diagnosis came from a psychiatric evaluation she had a few years ago.
Like, my mind goes first to kind of figuring out really what these diagnoses and what's going on, although I know that doesn't totally fix the kind of the situation. I like the thought of the RAP referral. she's a little bit too young, but just to like let you know of another resource, there's functional family therapy in the state. Dr. Swiger, I have some updates on how that process is actually working in the state, so I can share that with you. Found out yesterday. They're only taking 11 to 18, so she's a little bit on the young side. What county is she in?
Kanawha.
Kanawha. And I don't know, they can do virtual, but they can't do in person, I think, for Kanawha right now. So that's just something to kind of keep in mind if this goes, unfortunately, hopefully not a few more years. I'll let others give some thoughts and let me put some more thoughts together.
What about the family system? Who else is involved?
Really, it's just mom. Mom's mom, her grandma helps some, but mom is pretty much on her own. Dad is not in the picture. Dad has never really been in the picture. He occasionally pops up and
files petitions with the court wanting to get custody, but he has an extensive history of domestic violence and drug abuse. So he has actually ordered no contact with both mom and her, but that doesn't stop him, mainly because he's about to be arrested for failure to pay child support. So I think this was a last ditch effort to avoid that.
Has she witnessed domestic violence between the
Yes.
two? Do you know how many years?
I don't think it was very long. I want to say that mom and dad separated when she was probably 2 or 3, but she did witness it in her formative years.
And the grandmother, so you said mom's involved?
Yes.
Is she willing to help? Like, does she do childcare?
She does occasionally, and when mom was working, she was watching her when they were doing remote learning, and mom just had to have surgery and she watched her then, but it's nothing very extensive, like a few hours a week.
Yeah. Yeah, my recommendation would be, you know, kind of along the lines with Colleen would be within the system, because you know, it sounds like mom's getting her own therapy, the child's getting her own therapy, and just a little bit of family therapy, but the discord is within the family system. And so it seems like there's a pattern of interaction there between the mom and the child, right? And that can be common when domestic violence is about, which might be why she hates mom, but doesn't realize why, because she might have learned that pattern of interaction early on as a kind of a way to get her needs met. But then it just becomes a pattern of interaction, right? And I mean, clearly she can function at school. There's no problems with it at school. And so I think really family therapy needs to address that pattern of interaction that's occurring between mom and the child.
Yeah, it's just whatever interventions that focus on their relationship is really the focus. I mean, regardless of what the cause is, and you see this across multiple diagnoses, right? So kids with autism may be unable to have empathy or connect, or that, you know, trauma can do that, or you can have reactive attachment disorder that does those types of things. But you know, really with that degree of interpersonal disconnect, you really need to heal it in the family. Like doing it sort of in parallel process is actually can actually make it worse, because if you don't recognize that it's a family problem, the therapist could be telling mom, you need to be doing this with the kid, or you need to be doing this for yourself, and it's not within the system. So you can get mixed messages where the real goal is that what benefits their relationship moving forward is good for both of them. And I think it's just a frame shift in kind of care, because there's lots of reasons, like Amanda said and Colleen said, that could be, you know, happening. Like it's a long-standing pattern. But the other piece of it, and I don't, maybe I'm reading too much into the description, but you know, there's also this element, I'm not sure what the right term is, but I call it kind of the parental guilt, or the parental need to like have their own relief and respite, because you know, this reading the narrative sounded like this is a mom desperate to be fulfilled from her child, and that she's carrying around so much guilt and a feeling of failure and self-esteem because the kid doesn't validate her success or her cares, which I think is something that happens developmentally too, because young kids can't do that. This child really can't. I mean, really does not have the skills to say why she hits, or does not have the skills to say why she says those things. And you know, as a parent, having that hopeful wish that your children will recognize what you did for them and understand it, that comes if you're lucky in your 30s and your 40s, if at all. And so, like, I think there's this big, you know, like elephant in the room with that want that's probably not going to happen, but maybe that element of sort of psychoeducation that you know, and that's sort of the same. And we see that with foster families and out of care placement. You know, you take in a kid and you want them to appreciate all that you're doing for them and all the help you're trying to get, and they just really aren't developmentally capable of recognizing that. And so I think maybe a big psychoeducational push to sort of describe and get away from the idea that this kid is not going to be able to answer the whys or give back or do any of those things right now, and just accept that as what it is, but also validating that mom's still doing all the right things and getting all the right help, and how frustrated she is. And so I think pulling in the respite, the other supports, the other system to give mom a break is still really important. But I think making sure we don't sort of send the message that the kid's going to suddenly be able to say, I'm not mad at you, or I love you, or thank you, is really, I think, sometimes really important for people to hear. But as I said, I think moving forward, and again, I think you'd have to get both people to agree, but sometimes it's a shift from moving toward family, but sometimes moving toward family means giving up the individual, or because it depends on how well the individual kid and mom therapists are working together. If they truly are working together, that's fine. But if it's working in parallel, sometimes very mixed messages could be happening that might be worsening that interpersonal difficulty. And that's a really hard thing to navigate as a team, but might be kind of an elephant in the room too. I don't know what everybody else thinks, but I think that's a real shift in the idea of making the family better, the unit better than any one person, and everybody kind of has to be on the same page with that.
I agree. Sometimes that psychoeducation is so important in validating. Like when moms, sometimes when I have those conversations with moms, and like Dr. Swiger's talking about that mom guilt, like when I talk with moms and say they might, you know, this might be their expression of gratitude, like this might be all you're getting. And they're like, okay, like if I have that expectation, I'm okay. But leading towards higher expectations really is an emotional letdown. It can be like well, we all know, right? Emotional roller coaster when that happens. And so, yeah, I agree with psychoeducation is super important, and respite and helping. And I think like even setting up some consistent respite, right? And sometimes that needs to be completely facilitated. So sometimes you might need to help mom identify who those supports are in her life and how often that's going to happen, and even making that a goal, right? Like once a week for an hour, right? It's so hard for parents to follow through with that when it's kind of set like that. But when you start getting it to happen consistently and they see the difference in their mood, it's very beneficial.
Thank you so much. Oh, Colleen, sorry, I saw you just unmute.
That's okay. Yeah, I was just gonna, yes, agreed with everything that was saying. I was also looking at some of the things that have been tried in therapy, and I was just kind of building on this, improving that relationship between mom and the daughter. And I was going to Amanda and her PCIT, but I just thought of just like that parent direct or child directed interactions, just like getting back to positive interaction between mom and the daughter in like really small increments, 5 minutes a day, where the child feels some control because they're totally leading what's going on. And it's not about setting rules and responsibilities, because sometimes I think that we set too much we take away too much of a kid's control, they try to find other ways to kind of get it back. We're doing like this tug of war versus just like building that relationship by the child directed play might help start to improve the relationship. And if the expectations get a little bit lowered, the child's not gonna maybe show that kind of gratitude or thankfulness. And if mom sees something positive, that might just be the boost that they need to kind of keep climbing up.
I mean, I'm always an advocate for PCID. So totally agree, Colleen. But I mean, at 8 years old, so I mean, it could be a modified version. If she's functioning lower too, I think you could definitely find a therapist that would probably help out with some sort of modified version to help with some of the like Colleen's talking about, shifting that attention to the positive interactions between the two. And then, you know, when you've talked a lot about how they've utilized some compliance skills already. And so you can pull in some of those compliance and effective commands that could be helpful for mom. Especially if the child has a true diagnosis of autism, that behavioral piece can be super effective. And it's really beneficial with autism because it helps them feel safe and secure. And that will increase that interaction between the two.
Do you have any ideas on how I can encourage mom to continue to try to do the positive interactions when she's just really defeated because she never gets the response she's hoping for?
I think like Dr. Slager's talking about, having that conversation and exploring what it is she's hoping for, right? And then helping her lower some of those expectations and into what some of your observations are. I mean, are you able to have positive interactions with a child yourself?
Most of the time.
And what does that resemble?
Normally, if her mom is not in the picture, she'll sit down, she'll talk with me, we'll interact. We can talk about what she likes to do, what she'd like to do with her mom, how she'd like things to be. But then when mom comes back in and we all start trying to talk, that's when she will start to avoid the conversation. She'll hide her head under a blanket. She'll start wanting to play with her phone or her tablet. Like once mom comes back, she wants to shut down.
Okay. Do you see any glimmers of positive interaction between her and mom during your sessions?
I see a few, but usually within like a couple of minutes of it happening, she'll go back and do something that mom's already asked her not to do 4 or 5 times.
Yeah.
And then mom just kind of flies off the handle again.
Yeah. Yeah. So it's almost uncomfortable for her to have those positive interactions, right? And she doesn't even understand why she goes to that. I would, I think going back to your question of how to encourage that, those are the moments I would encourage, right? I would utilize some reflective functioning and delivering those observations to mom, like maybe not in front of the girl because she'll stop, but like on the side to mom and saying, did you see that? Like, I noticed that she really started enjoying you, and, who knows what happened? It might've got uncomfortable for her, but I would keep doing that, push towards that. What was that like for you, that moment she nicely handed you the toy or whatever it is, the glimmer that you saw, right? And remind her of that feeling and what that feels like, and help deliver those observations that you see, those positive interactions. It'll give mom more confidence and want to seek that a little bit more.
Well, and if she can't do it, the other sort of way too is to get mom, instead of for mom to feel guilty about her misbehaving with her, you can also get mom to brag on the things she doesn't see but hears from other people, which can really help make it feel safer when they're together. So, even having mom brag on, I heard you did so great with Cheryl today, or I heard you had a wonderful day at school. Even getting mom if mom can't find something to praise directly because she doesn't feel it, she will eventually see a shift change and just changing her language at praising the other positives that are going on. And that might really be maybe even a safer way for mom, if mom's having a hard time seeing the positive, just getting mom to praise other people's positives that happen can really like shift the conversation and maybe feel safer for both, because it's not something directive, but it's just really changing that process. And so, you know, if mom went through the day just bragging on what a great day she had at school, or the positive teacher report, or I saw you did great on your, you know, it's that catch them being good, but it doesn't have to be good with you. That can be that shift that might be easier for them to start with if the more one-to-one stuff is hard.
Yeah, I think that's great. I would also though prepare mom for some rejection there, right? Like just preparing her that it always gets worse before it gets better. And it's uncomfortable at first. You're changing that pattern of interaction. So it's going to be uncomfortable, right? So they're used to kind of pushing each other away. And now mom's trying to bring her in. And as she brings her in, she's going to get uncomfortable. So have mom just kind of gauge that. Okay, then you just step away a little, but don't take that personal, right? Keep trying. And so really building mom up to continue to keep doing that. It's like that circle of security, right? So you're helping the child become secure, but mom's reading that so that she backs off, because the typical pattern is that if she does it and the kid acts out, she backs away, and then they're both feeling like comfortable in their own space, but it's not working for them. So she has to change that.
Thank you so much. That was excellent feedback. Cheryl, do you have any other questions, or does anybody else have any comments or feedback on this case? Very difficult. I couldn't even imagine. You good, Cheryl?
Celebrate baby steps.
Oh man. Yeah. Salute you for the work you're trying to do. That's hard.
Well, thank you all very much, because this was more ideas than I had at this point. So I appreciate that.
And I go to see them tomorrow, and I told her I would share with her what we talked about today, and we would go from there.
Well, and remember to take care of yourself too, because when mom's feeling defeated, we feel defeated, and you're doing some hard work. So take care of yourself too.
Yeah, Mariah and I have talked about that frequently with some of the clients we've had here recently, that it's just been really, really hard because there's just a lot of things going on, and it's really hard to feel like you're actually making a difference when it seems like you're not.
Yeah, that's where you have to celebrate those small pieces. And one last thing that I always share with families and students around this time is the time for kids with behaviors. The time between Thanksgiving and Christmas is really difficult. Everything is completely unstructured. And for kids who love structure, that feels unsafe and unsecure, and they don't even realize it. But if you think about schools having, games and parties and videos, and they don't want to start anything new, that's scary for kids, but they don't realize that. And so they can act out with behaviors.
And Cheryl, I just want to thank you for bringing a case. I love cases. I am so glad we got to follow up with this. So I thank you so much. And I just want to say, anyone that wants to submit a case, we love cases.
Yes. Thank you. Really great job. I know it can be nerve-wracking, but we're here to help, and everyone's really supportive. It's a safe space. So that's what they're here for. We're here for is that connection and helping each other out. So thank you so much, Cheryl. And please update us on how it goes in the future. I'm really curious to see, what occurs.
Well, hopefully I'll have good news. So.
Yes. Even little, like Amanda said, even baby good news is good news. I think we've got to remind ourselves of that too. In the self-care portion, it's perfect because it's leading up to Colleen's didactic. And everyone can use some self-care. So, so I tell my husband, if I'm doing a mask, it means I'm doing some self-care. All right. Thank you so much again. And Dr. Lillard, are you ready for me to pull up slides, or did you want me to give you capability to control?
I can do it. And then if I have technical issues, you can jump in.
Absolutely.
Okay.
All
So many of you probably saw this presentation already, but it's been a long time. And I think it's just a good chance for us to take a little bit of time, maybe talk about where people are struggling with self-care. And I'd really like it to be kind of a brainstorm for everybody to talk about what they're doing for their own self-care and see if we can help other people who might be struggling where they are. So let me okay, are we seeing just the big screen?
Yeah, I am.
Okay, good. It's always that nerve-wracking. What is Zoom showing? So because we are still in COVID, despite what everyone sometimes seems to be acting like, COVID is still here, it's still an issue, we're still all feeling it. See if I can make it bigger so I can see everybody. I wanted to talk about this in the context of the COVID-19 pandemic, and providers at all different levels, mental health, even just like healthcare providers in general. So when we talked about this kind of closer, further back in time, and prior to the current pandemic, this was kind of how people thought about the responses. We've got business as usual, then like March 13th to the 17th, whatever date you want to choose, COVID hit the US, everything shuts down, and we're in disaster mode. But I think it's kind of interesting to look back now, when we all shut down and hit disaster mode, some people would argue these waves of COVID we're having now are much harder on the system and on people than even that initial crisis was. But that crisis happened, we had a chaotic rapid response. At some point, we started to adapt to that response. We started figuring out kind of life with COVID in a sense. We got some new routines. The problem that I see with COVID is that there's almost this arrow that needs to go back up from new routines to the disaster, crisis, and event, because it seems like every new variant that comes out, every new wave that we experience starts this whole cycle again. And so we're not able to make new routines and move on with them back to a business as usual. Because I think really the goal was to take new routines back to business as usual, but we're in this kind of like stuck in this cycle at this point in time. And I think it's leading to a lot of healthcare professionals feeling very burnt out. There's compassion fatigue and moral injury and everything kind of going on because we're just cycling through this mode. And so I think it's important for us to recognize that just because we may have hit a routine, we're not kind of out of the woods. Things aren't necessarily better. And we're gonna have to, again, there may be make it chaotic. We have to adapt again. We have to have new routines. We're in this like flex mode of some people in person, some people by tele, that can be difficult. So I wanted to talk, I didn't mean to get rid of there we go. So I wanted to first look at this slide, and this just talks about the different areas in which we may feel that stress and tension during these difficult times. It may manifest itself in physical issues or concerns. It manifests itself emotionally, it manifests itself cognitively, how we think, how we talk to ourselves, how we talk to others, what we think about others' interactions with us. And then we also have behavioral responses. So we're going to look at trying to talk about coping strategies, kind of covering these 4 different areas. Always reminding ourselves that there's no right way to feel right now, and that our feelings may change over time, even days or hours, it seems. But I thought this was really an interesting idea. This also comes from that, that Schwartz Center that's noted here, noted on the bottom. They have a lot of information about psychological first aid and that kind of care for healthcare professionals. They talk about that there are 5 evidence-based elements that are shown to improve outcomes in situations with ongoing threat. And so that's why that first slide is important, because this is a continuing ongoing threat. sometimes things might loosen, but then we're back in the throes of COVID. And so I think it's important that we can then look at evidence-based. So research has shown that when these things are in place, there are better outcomes for providers or individuals even that are stuck in situations of ongoing threat. And some of this comes out of the VA and is looking at, you know, people who are maybe they've gone to war, or they're continuing to work with people, even like the National Guard having to go to natural disasters and things like that. So what improves outcomes is an increased sense of safety. So with COVID, an increased sense of safety is having the correct PPE for healthcare providers, or giving that flexibility of work from home, work in the office, but work by tele, you know, continuing these conversations by Zoom, continuing maybe didactics by Zoom, or client sessions by Zoom. This idea of calming, this is where your normal like kind of self-care tips that everybody always wants to give, like do some deep breathing, let's do mindfulness, do yoga, and everything will be okay. So what this shows, you don't have to have all 5 of these, I will say, but that there's like pieces of them, and having pieces of a lot of them can improve the likelihood that we handle an ongoing threat well. So finding ways to calm your body physically, your body emotionally is important. Connectedness is really important. Finding ways to connect with support systems, family, friends, co-workers, connecting and staying connected is very important. And again, when COVID started and everyone was home and we weren't going to other people's houses and having to do everything by Zoom, there was this question of connectedness. And then Zoom kind of helped us be a little bit more connected with people. But then within work, making sure we're staying connected and checking in with our colleagues is really important. The next one kind of goes off of what we finished up talking about with Cheryl just a little bit ago, is this kind of self-efficacy. And when there's this ongoing threat, or you have a really tough client, we start to then feel like we're not successful, we're not capable, we're not doing our job like we should, when that comes back to that kind of cognitive self-talk, speak, and kind of keeping up that self-efficacy, keeping up that kind of your positive self-talk, your checking in with the cognitive distortions you may be exhibiting and how those can be affecting your communication with yourself and with So there's kind of this waxing and waning, but just trying to find that little slimmer of hope. We have vaccines available to everyone. We are now finally, kids ages 5 and up can get vaccinated. So that's hopeful. I know as a parent, it's stressful to know that your kids are out there in the world interacting and and there isn't that sense of safety for them because they may not be able to get the vaccine. So for me, that was very hopeful. That's coming out, and I've been trying to read on when my 3-year-old can get vaccinated and when my 4-month-old will be able to get vaccinated. And so that's my way of kind of keeping hope, even though we have this ongoing threat going on. Anyone have any thoughts on these 5? Chandra?
You know, I'm kind of frustrated to the point where I mean, it is still a threat, and a lot of people are not taking it as a threat. Like, I've worked from home for 6 years and I love it. I'm rarely around people. I live with just my cat, and I just got diagnosed with COVID Monday, and I have been ungodly sick since I got my booster shot. And I just feel like places are too relaxed already, and I don't think we're at that point yet. I'm just I'm overly cautious perhaps, but I'm feeling like too many people are just saying, oh, I'm tired of wearing the mask, and enough is enough, but at the same time, it's not over yet.
Right. Yeah, I absolutely agree with you. And I think that starts to hurt our sense of safety, right?
Yes.
You could do, I'm really sorry that you got sick. You can do everything you can to stay safe and get, like you said, you got your booster, and still find yourself getting,
Yeah.
from
I
it.
just think there's such a misconception that all of a sudden it's better, and it's not quite over yet. We're nearing the end of it, but not quite.
Yeah, I always try to remind myself, they say that that Europe is about 2 weeks or so ahead of us with it. And so when you start to hear the UK is getting more hospitalizations, it's when I like hunker down in my mind that things may be coming back around.
But it's very stressful that it's always looming over your head, and and it's tough. I have tons of patients that still are anti-vax. They absolutely do not want it. They won't get it. They're around immune compromised people, and it's frustrating.
It is very frustrating. I think in January sometime, Mithra will have to correct me on the date. I have a presentation on misinformation, and a lot of that is kind of talking about communicating. How do we correct misinformation? How do we work on helping people understand the vaccine is safe? And there's absolutely no easy answer. And West Virginia is not doing well vaccine wise. I traveled for Thanksgiving, and my parents' county in Pennsylvania is a 36% vaccine rate, and it just, yeah, it's very tough. And that's where I was hopeful that one of my children has 1 dose of the vaccine, a little bit safer than the other 2.
Thank you.
The other thing that I liked about this list versus just kind of giving self-care tips for people is that I think that this is something that agencies or leaders within groups or organizations can think about, because some of this isn't just about a healthcare professional on their own, keeping their own mind and body calm, but it also has to do with the structure of the environment that they're working in, and how can that be structured and organized in a sense that's going to help us have good outcomes with this ongoing threat. So are there ways that an agency or organization can increase the sense of safety in its employers? Ways they can help with the calming, although the calming is a bit more of the individual person. Ways that they can work on connectedness and think about self-efficacy in their employees, as well as hope. Anybody have any thoughts maybe on a way that an agency or organization they work for has done a good job in any of these areas? Oh man, crickets today. I hope that doesn't mean that your agencies are not doing a very good job. Any way you think that agencies could improve in any of these areas to help their professionals continue on with an ongoing threat? Go ahead, Anastasia.
I think it's one of the things that I think we're doing really well here at WVU is we have made some ways to do things remotely. Like I had to work remotely Monday and Tuesday because we had some COVID exposure. And luckily I was able to do that. And so I really appreciated that because that gave a lot of calming to me and that sense of security and being able to still be connected with my colleagues and still be able to check my email and all that. And I think the WVU is really good with trying to like incorporate that more so than some of the other entities around the state. I know I have some family members that they aren't able to work remotely. And so it's a lot more stressful whenever they're in that kind of situation.
Yeah, and unfortunately, sometimes it's just not possible, right? I think about our state hospitals or inpatient facilities, the residential treatment facilities where people have to be there in person. And so I think that's where we have to be a little bit more creative thinking about how to improve this sense of safety. And if we can't maybe get an increased sense of safety, but maybe they can work on connectedness and efficacy and hope and calming there. Any last thoughts on these? I cannot see my time. Okay. So let's stop here. And I want to hear from people some obstacles that they've had or coworkers, colleagues, friends, family have had with self-care in this times of COVID. Where's the struggle?
I can share one of my experiences. I'm not a clinician, but I know in the beginning when we moved full-time remote, it was really hard for me to just like dedicate 1 hour to lunch. So I would just be like in front of the computer or doing some like work on my notepad, but I would always tell myself, just take an hour, step away from the computer. You don't have to check your email at all times. And I had it on my phone too. So it was easy to just like pick up my phone and see the work email. So I would just kind of, take that hour to myself, enjoy a good lunch, maybe step outside for some fresh air, go for a little walk. But I know for me, that was kind of challenging and it was an adjustment, but I took the time to do that and I felt so much better once I did.
I think that's a wonderful piece of advice. And I think even for the people in the office, how many times do I work through lunch? Even when I'm here, how many times do we have this meeting and we're still eating lunch because there's no time? So yeah, I think carving out those little bits of time when you can, or basically making it a priority, right? Lunch and eating and my wellness is important and I'm going to take the time for it. That's great. I need to take after me through a little bit there. Anyone else want to talk about obstacles of self-care? Maybe I should have started with a quiz to see how everybody's doing with their self-care. Maybe everybody's like awesome. They figured this out. They're no longer stressed about COVID. They're no longer stressed about work. Everything's going well. Is that the consensus?
I wish.
Right?
No, I mean, I'll talk and give you guys like some time because you better talk after this. I lost my job prior to this job when COVID happened. And so I was out of work for a little bit and I'm a person that needs to be busy. So like, I just couldn't sleep. I would be up till 5 a.m., not taking care of myself, just always not eating healthy at all. Like everything was going downhill. So I really had to set a routine. And I think routines can help a lot for me, at least the kind of person I am, whether it's just like making your bed in the morning, just doing something that makes you feel like you completed something, especially when you are out of work or just, overcome by other issues and things. I think that really does help me feel a little more positive about my day as a person. So even with work, I still have to set a routine or it really like affects my anxiety and depression. So that, and I always feel like I'm the only one that can do all of it where it says only I can do XYZ. I am that kind of person completely. So I get really irritated if somebody doesn't do it my way. And then I just feel like I have to do it again and then just add stress instead of just saying it's not that big of a deal. The dishes are going to be okay. I think just picking what we're trying to stress over and taking a break from it for me, it helps. Sorry, I talk forever, but anyone else?
Yeah, no, I like that. I know for myself too, only I can do X, Y, and Z gets me into trouble with work, especially, and finding even the littlest thing to delegate to somebody else or to just like get rid of is so powerful and can make such a big difference in just how you approach your day. It may not even change really how busy you are, but it feels good to kind of let one thing off of your plate. And I think when I think of those kinds of things, I think of values, and the more that we're like trying to consistently stay in tune with our values, then it's a little bit easier to let those things go. Like I don't necessarily have a value for dishes, you know, them being clean is important. My house, you know, having a kind of this baseline level, but knowing like where I need to prioritize my time. If I try to deal with my values, it tends to help. Jackie, did you have something to add?
I have some sort of Elizabeth thing as well about anxiety and depression if I'm not working. I'm like her. I lost my job too, and spent 2 years looking for another one. But the main thing that's helped me is my team that I work with. If you're working with a team that are always kind of yan back and forth and nobody's happy and nobody's, you know, getting along, it makes everything double hard. But when you've got a team that backs each other up and obviously cares about each other, even to the point of doing their work so they can stay at home with a sick child or whatever is needed, then it almost makes work seem like fun. And I tell my boss a lot that I've got the best job I've ever had, and I'm 62 years old. So it's, I love working with my team.
A really great point. That connectedness is really important. And if the team you're working with is really difficult, the connectedness can't happen or doesn't happen as well. It does make it kind of twice as hard.
I think it's also so difficult not to take your work home with you. Like I work with, very underserved families in West Virginia, and most of them have lost their jobs because they've worked in like restaurant, retail type businesses. So they can't afford gas for their car. They're struggling to keep their heat on. And it's just heart-wrenching to hear the stories. And, they've lost like their mother or their aunt to COVID. And it's just hard to leave work at work when you really care what, you do. So I think learning how to leave work at work will help a lot too with the stress.
Yeah, and I worry that COVID and the telework from home has made that harder for some people. I know I have a colleague here who's really good about having a routine. She talks about a routine even with her like badge at work, that like she walks out the last door, she puts the badge in her work bag, and that to her is like work is shut off. And I think that's a really, I always want to tell the story because I think it's such a great thing that she does. But when we were fully at home, it was really hard to do that, right? Like I could hear my kids yelling downstairs and I was not able to then be present at work, or that 4 or 5 o'clock end of work time bled into 5:30, 6 o'clock sometimes. So yeah, keeping those boundaries when at home can be really difficult. And then even just emotionally thinking about the cases and the people that we're seeing. And I think it starts to bleed into that self-efficacy. I'm not doing enough. Am I doing enough? Questioning yourself as well.
Yeah, I did that when I was working from home. I was working in my bedroom, and that was like my safe space, right? Like at the end of the day, when I wanted to get away from everybody, I'd go in my bedroom and shut the door. But like, I felt like I couldn't then because I'm at work in there and I don't want to be in there in the evening then because I was in there all day. So I had to learn to separate my space. So.
Yeah, that's another good one. Separating your space, either physically or emotionally, finding a way to separate the two. I'm going to flip past these. I think this slide is important for us to keep in mind. There's some interesting research and literature talk right now about this idea of burnout. So everybody's talking about everybody's burnt out, and that where is that burnout coming from? And there's actually this when it comes to COVID and really frontline workers, there's this talk about the shift from burnout to like moral injury. And it's this concept that it's knowing what the right thing to do is, but then because of some systemic barrier, not being able to do it. And so on the kind of extreme example would be a nurse knowing how to save a patient's life, but because we don't have enough oxygen in the hospital or something, they can't do it. But it also made me think of what Chanda was just saying about her patients, of like, we know that they need heat on in the wintertime, but we can't just use our money to pay for all of our patients. And so that starts to get people really down about the process. And moral injury, those 5 steps are really important back there to kind of ease the burden of them. And it also comes from a little bit more of a systemic perspective of agencies and network and organizations there. Lauren, did you have any comment? Okay. You can keep your.
I recognized I had turned my camera off, so I was just turning it back.
I was like, oh, you turned it on, maybe. But in talking about burnout and compassion fatigue, I think it's really important that we're thinking about this as an ongoing threat. It's a marathon, it's not a sprint. We're not able to think about COVID as being over January 1st. But also there's that kind of saying that when you're on an airplane, you put on your mask before you put on somebody else's mask, right? We have to take care of ourselves before we can continue to take care of each other, especially with this ongoing threat that seems to continue to be looming. And they talk about the effectiveness of providers. It's increased by knowledge that everyone reacts and copes in their own way, and kind of giving people that kind of grace and space that they're doing the best they can with what they have at this moment. And remembering that what you're doing is making a difference. Even those little tiny glimmers of hope that Amanda talks about, those little baby step successes, we got to make sure we're celebrating them and that we're recognizing them and we're not getting caught in this, yeah, but it's not enough. And not in a toxic positivity sort of way, but trying to reframe things to be a little bit more positive can help with that burnout and stress. So I think I'm going to stop there. You guys will get an email with the slides in it. So that's where all these little tips come into play for self-care. But we have like 3 minutes left. So I'm going to leave it for any comments, questions people have. Elizabeth, you're muted.
Thank you so much.
Just let you keep
great.
going.
Just kept going, I'm just gonna go with the flow. No, that was really excellent. Thank you very much. And I think this is a very important topic for everyone, especially as providers, because you are taking on stress and everything that's going on in others' lives and trying to separate it a little bit. That would be very difficult. I feel like everyone, I pull energy from other people. So just as I think Jackie, you were mentioning being around really great coworkers. I think that is very important, because that energy, and sometimes we're not going to always feel 100%, but our coworker can. And I've been really lucky and fortunate with my group that they've been helpful when in times of need. So thank you for that. And I love skincare. So if you want tips and tricks of steaming your face or feeling relaxed and taking a break, that has helped me a lot. So now I have like a 10-step routine. I mean, Mitra last week, I have like cream next to my desk, hand cream, everything smells like I like to open this and smell it. Hey, what works for you works for you. And if it's gonna keep me looking younger for my younger husband.
That's fantastic. I got my hand cream here too. A little bit of smell, skin feels soft.
Yeah, it just makes you feel good. It's just like that. What is it? ASMR? Is that what it's called? I don't even know that much about it.
ASMR, about, like, isn't that the whispering?
I don't know if I'd like that, but I think like smells or like watching like weird videos where like, I don't know, cakes getting cut like perfectly. That does something. I don't know what it is. Really strange, but hey, it works to calm me down. So
we all have to find our own strategies.
Yeah, Dr. Tucker.
I think the other like really important part in all of this is what an active process it has to be. I mean, none of these are passive. You have to make the time. You have to make the effort to do these things. They just don't happen, and you can't just pay them lip service. Like, they're all important, whatever, but you have to take the time to look for the positive. You have to take the time to do the routine. You have to build that in and make it an active part of wellness.
Absolutely.
Yes, very important.
Well, if that's all, I really appreciate today's discussion, and our next meeting is going to be December 15th, and Dr. Lillard will be discussing countering misinformation. So another
Oh, so I was thinking it wasn't until
Okay.
like February.
Okay.
There you go.
There you
Sandra,
go.
there's your talk is coming in 2 weeks.
Excellent. Thanks,
Hey,
everyone.
can I ask the group a question?
Ooh.
I'm on the board for January 5th, and it's supposed to be on medications again. And I know that many of you have heard me talk on that. So I wanted to see if I could poll the group to see if there was any particular focus that you wanted on any certain medicine, any certain diagnosis, if there would be a particular area I could prepare for the new year with that topic. Does anybody have any requests?
I'm
Thank you,
struggling with
Aisha.
diabetes, if you want to take a shot at that.
Jackie, I think I would be doing you a disservice if I even attempted.
Well, I have this round robin of diabetes, kidney stuff, and heart stuff, and one creates stress on the other, and the other two create stress on the third. And so
Would it be helpful to talk about like sort of prescribing for like depression, anxiety, and stress in the context of medical?
oh, that's in there too. You can do that too.
Would that-
Possibly bipolar medications.
Bipolar
A lot of
medicine?
those affect your blood sugar and.
Oh yeah, oh yes, we can link this. Good. This is what I needed. Okay.
All the minds.
Those are two great ideas. Thank you all.
Body and the mind is not separate. They're intertwined.
Awesome. Thank you. And if you have any other ideas, just pass them along my way, and I can let Dr. Zucker know that too. You can't think of any on hand right now. I hope, I hope you guys have a really great rest of your day, and I will see you here soon.
Thanks,
Bye-bye.
everyone. Bye.
Bye.